Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers from here in Houston and our sister city, Philadelphia, which recently joined the global network of 25 cities working to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this effort is to help people with diabetes and their caregivers successfully transition through these very challenging times of COVID-19. Each Saturday, we gather diabetes care experts to discuss and share their incredible knowledge about diabetes. They have years of experience in self-care, in medical care, public health, community health, and advocacy, and will bring this knowledge straight to your waiting eyes and ears. We hope that these conversations will give you the tools to build skills to manage your diabetes and to live your best lives, not only surviving, but thriving and doing the things you want to be doing. Today's episode is coming up right now. You don't want to miss this. Hello again. The content we share during this MyDiabetesHQ live broadcast isn't intended to be a substitute for professional medical advice, diagnosis, nor treatment. As always, seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding any medical condition. So once again, hello to all you diabetes warriors, champions, advocates, and cheerleaders. Welcome to the fifth episode of MyDiabetesHQ Live. To our viewers on MyDiabetesHQ Facebook and MyDiabetes YouTube channels, thank you and welcome to our show. Good morning, Alicia. We're happy to have you here with us. The format will be simple. We'll begin with comments and observations from our guests and then weave in questions, comments, and tips from viewers like you. We'll try to get to as many questions during our time together, but even if we don't get to your question today, leave it as a comment down below. You never know if your comment will be the headliner for the future shows. Sign in and subscribe to any of our platforms so that you can be a part of the conversation today and every Saturday. So today, we're exploring food insecurity during COVID-19. I think this is a very timely topic, and my guests agree across the U.S. and in our two U.S. cities, changing diabetes cities, Houston and Philadelphia. Food insecurity was already a very difficult reality before COVID-19. According to Feeding America, it affected 1 in 7 families in Harris and Philadelphia counties prior to COVID-19. And now it's affecting 1 in 5 families. Our two guests today will educate us on this topic, and we will discuss strategies that communities and families can pursue to reduce food insecurities. So first, we have Dr. Shreela Sharma, professor at the UT School of Public Health and co-founder of Brighter Bites here in Houston.
Good morning.
Next, we'll have Gina. Hi, good morning.
Good morning.
Good morning, Gina. So next we have Gina Trignani. I said it correct, right?
Yes.
Excellent. She is Director of Training and Capacity Building at the Health Promotion Council, part of the Public Health Management Corporation in Philadelphia. Gina is a very active member of the Cities Changing Diabetes Philadelphia Advisory Board. We will also have joining us Serena Valentine. Good morning, Serena. She is CEO of Core Initiatives at Houston, a new Houston nonprofit health and wellness organization. She brings her experiences as a person living with diabetes to her work as program coordinator for another Cities Changing Diabetes initiative, the Houston Diabetes Peer Support Group. She is also a member of our Houston core team. And lastly, and certainly not least, we are joined by Marianne Strobel. Good morning, Marianne. There you are. She is a registered nurse and certified diabetes care and education specialist. She has over 20 years of experience. In addition to her inpatient and outpatient work, she has a very, very real passion for working to improve diabetes care and management around and during emergencies and disasters. She works specifically with the Diabetes Disaster Response Coalition, and she serves on the core team for Cities Changing Diabetes Houston. Marianne herself has navigated lots of care and outreach for her patients, and she's also the mother of a daughter living with type 1 diabetes. Good morning, everybody.
Good morning.
Good morning.
So before we get into our conversations, we're asking Dr. Sharma to please help us understand and help our viewers understand food insecurity as a concept. How would you define it, and how is it associated with other challenges that families with chronic diseases face, including chronic disease of diabetes?
Yeah, good morning, everyone, and thank you for this opportunity for this very important conversation around food insecurity and also how it impacts health. Food insecurity is essentially defined as lack of access to food to lead a healthy life. And so when we think about a healthy life, it's not just about any type of food, it's also access to food, to healthy foods such as fruits and vegetables and whole grains and everything that you need to keep your nutrition optimal. Food insecurity has been a problem in the US for many, many years, but since 2008, right when we had that economic crisis around 2008, the food insecurity levels started climbing up and have stayed up around 13% right now in the US. So 1 out of every 10 families are struggling with food insecurity, which equates to about 40 million Americans. The part that's challenging is that households with children struggle more with food insecurity as compared to households without children. So our most vulnerable are at a greater risk. And then we also know that food insecurity is linked to many poor health outcomes. So families that are food insecure also struggle with other comorbidities such as diabetes, the one that we're talking about today. So it's definitely an issue that is highly relevant to the conversation of health.
Yeah, I think that for those of us working directly with our patients, we've definitely seen those things ramping up. Gina, what, from your experience at the Health Promotion Council's work in Philadelphia, and across Pennsylvania, how have these challenges been exacerbated due to COVID-19? I know for us here in Houston, even just driving out here near NRG, we have, it's a location where people can pick up food during the weekends. And I'm not sure if other people have seen it too, but I've seen the lines wrapped around and it's just increasing. What have you all been seeing in Philly?
In Philadelphia, we have quite many food deserts, especially in the inner cities. So with COVID and the shutdown of transportation, while there are many sites to retrieve food and access food, again, there's such a demand. So we are experiencing similar issues in Philadelphia.
So what solutions are currently here? Both of you have such amazing programming and teams of individuals who who are really passionate about aiding individuals. Can you both share with us the existing resources that you have and how we can access, how your organizations are involved in those?
Sure. I'm happy to go first. I have a few slides if someone can pull those up. So I've had the privilege of co-founding this nonprofit called Brighter Bites, which I wanted to share about that today. And the mission of Brighter Bites is it's a nonprofit organization that's based in Houston, but is currently operating in 6 cities: Houston, Austin, Dallas, New York City, Washington, D.C., and Southwest Florida. We would love to come to Philadelphia as well, Gina. And the mission of Brighter Bites is to create communities of health through fresh food. And the idea really evolved from, my partner in crime, Lisa Helfman, who we founded Brighter Bites together. She participated in this fruit and vegetable co-op. And just by participating in a fresh fruit and vegetable co-op, she found that her kids' eating behaviors improved, so much so that when her 6-year-old went to a birthday party, he asked if he could eat fruit instead of cake. When does that happen? And that kind of, the light bulb went on in her head. And shortly after that, we were introduced to each other because a lot of my research at the University of Texas School of Public Health is focused around food insecurity, around healthy nutrition, and promoting child health primarily. And so we worked on developing the concept of Brighter Bites with a twofold aim. And if we can go to the next slide, which kind of shows our formula. The aim is to combine access with education and focus among families who need it the most. So the formula, it's a new kind of a food co-op is what we like to say. And starting from the left, we have produce distribution. So we know that behavior change happens among kids and families only when access is combined with the education. Just telling eat more spinach because it has vitamin K in it doesn't really change the needle unless they have access to the spinach, and then they know what to do with it in terms of making it a tasty and a flavorful food. So we send families home each week for 16 weeks in the school year and 8 weeks in the summer. We implement the program in schools, so the entire school can participate, whether it's families or teachers or parents, everybody can participate. And every family and teacher goes home with about 20 pounds of delicious, fresh produce. And we have a very, as a dietitian, we're all very passionate about food, and we have a very defined grid of food produce that we source out of, so that we're giving families a variety. So every family gets 8 to 10 different kinds of fruits and vegetables. And the whole point is to create excitement around produce. And the produce is, we don't want to give the same apples, carrots, potatoes, tomatoes each week. So we build a bag so that everybody's getting unique and delicious and a variety of produce items each week. And then we combine that with a lot of education, teaching the parents how to use what is being given. I'll share a story about this mom. The very first year, we were doing all the bagging of the produce in the schools. And this mom would come week after week at the co-op and bag the produce with us. And one day you start, of course, building relationships and chatting. And this mom was like, well, I never used to buy Brussels sprouts because growing up, we always boiled them and it didn't taste good. Well, we all know boiled Brussels sprouts don't taste good. But through Brighter Bites, when you gave us Brussels sprouts, you taught us how to roast them. And so, my kids now love it. And so even when you guys don't give us the Brussels sprouts, I go to the grocery store and buy it because my kids want to eat it. So, that's the whole, it's about connecting the dots, that you introduce new foods and tie it with, flavor and deliciousness and how to make it taste better. And we collect a lot of data around it. And I'll share this quote that summarizes, the ethos of the program, where one of our parents said, "Brighter Bites made me cook things I wouldn't have bought for fear of wasting money if my children didn't like it." And that sort of sums it up, right? Because even as a parent, I have 2 boys. Even as a parent, when I go to the grocery store, I think about, are my kids going to eat it? Because I'm not going to be able to make 15 different things every day. And then, is it in my budget? And both of those, I have those both. And then, is it going to taste good? Do I know how to prepare it? So, all of those boxes need to be checked. And so it's that demystifying and removing the intimidation by produce. That's kind of the essence of what we try to do with Brighter Bites. So we went from one school in 2012 with just 150 families. We're serving 25,000 kids each week across the 6 cities that we're in. And we're looking to expand and grow. And the whole point of Brighter Bites is, if it ain't fun, it don't get done. And you want to create that excitement and fun around a healthy item, right, which is fruits and vegetables. And that's kind of what we're trying to do with Brighter Bites. I do want to, going into a couple of serious points and where we are. If you can show, I have a couple more slides just to kind of show what we saw in our family. So all our families are low income, and some of the numbers went missing from the slide. But on the very right, we serve only low income families. So we choose the income status at the school level. 75% of the kids are on the free and reduced lunch program. That's it. We don't further stigmatize the families in asking them specifically about their income level. So on the left, you see at baseline in fall 2019, about 71.5% of our families said they were food insecure. And this is using a validated, the 2-item hunger vital sign. And you see on that increased to about 93.5% of our families during COVID saying that they're food insecure. 93.5% is pretty close to 100% in terms of food insecurity. I have one more slide. Let's see if the numbers show up there. So when you think about food insecurity, there's all of, we asked them about what else are they struggling with. Because with Brighter Bites, we wanted to, school closures stopped the program, but we wanted to still continue providing services to the families. And, I can talk about that a little bit later, but this is what our families said that they're concerned about during COVID. So in addition to 93.5% saying they're food insecure, that's as close to 100% as you're going to get. 76% were concerned about financial stability. 43% were about employment status. 70% about availability of food. Almost 50% on affordability of food. And so on. And you can see that it had nothing to do with transportation because only 6% were concerned about transportation. And so it was primarily because of shutdown and COVID-related concerns, and most of all, about their financial stability more than anything else, because they went into spending trade-off. I need to pay my rent. I've lost my job, so I'm not going to be able to buy the food. So COVID has really further highlighted the need in our families in ways that we have never. It's unprecedented. So, and I'll stop there.
Yeah. So now that you've sort of outlined that for us, the intersection between having access to food, concerns around access to food. Something else that, I think Gina's program also includes the considerations for all of the other things that are also surrounding food insecurity concerns. Gina, can you tell us about your programming and how that is correlated?
Sure. So at Health Promotion Council, we run a number of programs, and one of our primary programs is the SNAP nutrition education programming that we offer in schools and in homeless shelters and in the city clinics throughout the city, including the Public Health Management Corporation Health Network. And then we have family services. So we teach fathers how to be better fathers. Through that, we instill the importance of healthy eating and being a role model for their children. We have tobacco and substance abuse programming. And again, tobacco use can be a competition with food when someone has an addiction to such a powerful substance. Making a choice between satisfying a craving with tobacco versus getting food can sometimes be a challenge. So what we try to do, HPC, we see ourselves as connectors. We connect individuals throughout all of our programming to resources, and food and health is a primary area that we focus on. So in our SNAP Ed Nutrition Education program, we do make sure that people have access to food stamps. So not everybody that has access to the programming may be receiving food stamps, but may be eligible. So we do make sure that people have, number one, access to that financial resource. And then throughout the other programming, we're always looking at how do we connect people to the resources that may be out in the community, again, that may be competing with dollars that they may have to spend on food. So whether they need assistance with utilities, rental assistance, diapers, things, basic human needs, we make sure that we try to help them address some of those issues to free up those dollars that may not be covered completely by food stamps and food assistance programs. And then making sure that people have access to the extremely rich resources we have in Philadelphia around accessing produce and healthy food choices, even when a supermarket may not be available in the intercity, in the zip code where someone lives.
So these are both solutions. Oh, go ahead.
No. I was just going to add to what Gina said, if that's okay. In Houston, it's interesting. I mean, I love hearing everything, because what we've realized is the same thing that, Gina is talking about, which is these families need that wraparound kind of a service right now. COVID-19 concerns are very real for them. They're facing a financial pandemic concurrent with the COVID-19 pandemic, and at the same time, and their kids are at home, and it's, just surrounded by many of these issues and concerns about contracting COVID themselves. And so, we also learned that health literacy was a major concern among our families. So in addition to there's one thing about the services being available on websites like, sign up for pandemic EBT. Well, but how do you do that? And so, so with Brighter Bites, that's another thing that we did, is we pivoted in distributing food by collaborating with food banks and YMCAs at all kinds of distribution sites in produce boxes. So they drove up and put the produce in the car. But then we also developed a whole robust portfolio of health literacy that went beyond food. It had everything to do with eviction notices and how do you find information around that for where you're living, testing sites for COVID-19, where do you get information that's valid and accurate about keeping your family safe during this time, where can you find transportation services or service, we had families who were sort of trapped inside their home because they had COVID or someone in their family had COVID, couldn't go to the store. So we even did grocery drops and baby formula drops to their homes because these were emergency services that they needed. So, what we've learned, I think, not those of us who've worked in, is that you have to meet the needs of the families, whatever they are and wherever they are, you know, and that's kind of been the bottom line learning experience, is that we've, you know, nonprofits and government agencies have come together in ways that they probably weren't before to meet then all of the needs of these families. So Brighter Bites, even though the mission is food, it has gone above and beyond in terms of health literacy of every kind, you know, and we partnered with a lot of like Baylor College of Medicine and UT Medical School here to pull the medical community in and develop a lot of these health literacy components as well. So it's definitely taken a lot of partnerships.
Right.
Yeah.
Dr. Sharma, you're absolutely so right. I work in the inpatient arena, and so when I talk to some people with of our patients, sometimes I hear a story where, you know, their health deteriorated just because exactly of what you said. They're trying to ration, whether it's rationing, buying, you know, healthy food, or they decide to buy the healthier food or pay the rent. They don't buy their medication. So I think it's so important that, you know, as part of your expansion of your mission, to go forward, and as what Gina is doing as well, is looking at those other avenues of where they can, you know, look at what they do have available and then try to spread it around and try to make everything work. So thank you both for all that great work that you're doing. You know, I see it on the front line and it really does work. And so thank you so much for that.
Yeah. And I think the name of the game is always collaboration, right? So like each one of your programs has multiple program components, and everyone within those components are strong in what they do. And so having, you know, perhaps having at one of the sites for food pickup, having flyers that also talk about, you know, resources for energy, for diapers, for medication programs. I think those types of things are incredibly useful when put together with the primary need, right? So the primary need will bring them to us for care or for aid, and then we introduce, you know, something that we know may be also a concern. What do you think, Serena, in terms of like peer supporters? What are peer supporters saying?
They're echoing a lot of the same things that we're hearing about today. They are concerned about food, but not just that. It's, you know, everybody has this thing where eating healthy is more expensive than eating whatever they want to eat, which in retrospect, if you think about everything that's into play, if I live in a food desert, and I actually do live in a food desert. If I have to travel to the other side of town to get fresh foods, I still have to spend money and gas to go over there in the first place. So it's like I'm probably going to end up spending the same amount of money if I go to the convenience store. Now, we know the convenience stores are going to be sky high for anything inside of there because it's convenience, right? So that's what we pay for. So a lot of what people have been expressing to me, they've been taking part in all of the programs going on around the city, especially right now. But they, you know, food is really big. And, you know, because everybody's been quarantining, we do the quarantine snacks, you know, all the fat snacks, the Twinkies, the cookies, the chips, and, you know, because it's leisure food. But like it's important, like with the programs that we've heard about today, about the education part of it, because, you know, we can say, oh, well, I'm just going to eat like this for a little while. When I finish quarantine, I'm going to go back to a regular routine. But what if you never go back to a regular routine? Do you continue, you know? And so, yeah, it's a lot about knowing and not knowing and stuff
So
like that.
is there a component, Gina and Shreela, say you come and you access any of the programming, is there a way that people can know that, you know, if you've picked up this bag of healthy foods, it's really availability, right? So healthy eating, active living that we send our patients to through the School of Public Health. It's whichever sort of produce is available in season. And along with getting that that assistance or that 30 bag of things that you've never seen before, people are invited to learn about them, right? So now that we're dealing with COVID, so we've got, you know, yes, I have access to this wonderful, I have no idea what durian is. I don't know how to cook it. Is there a virtual component that you can say, look, I got, you know, a can of beans and a bell pepper and an onion, and I don't know what to do. Do these things go together? Is there like a virtual component that families can go to figure these things out?
Sounds like a great recipe for chili.
Right?
Yeah. So absolutely. I think, you know, with telemedicine and telehealth, I mean, I think we've been able to leverage technology in all aspects of care, whether it's medical services, social services. And so, yeah, with Brighter Bites, we have series of these videos that we've developed and are available for the families. We are in the process of developing also a mobile app that's going to be free, that's going to have all of these resources on your fingertips on the smartphone. And we've been providing all of that information. You know, everybody consumes information differently. I'm most likely, honestly, if you text me something, I'm most likely to see it and read it rather than, oh, you ask me to see a website or, you know. So we've tried to, I forget the exact number, but it's in tens of thousands of materials that we've tried to provide the families during this time in different ways, whether it's via text, including you know, recipes and videos on how do you cook what you've received this week. Also, how do you make your produce last longer, right? That's a big part. How do you cook with, you don't have to have fresh all the time. Frozen, canned is fine, but how do you, you know, make healthy meals out of all of that? So that's kind of what we've been focusing on, is stretching your pantry and your dollar, essentially. And I just want to add that, you know, huge shout out. We actually have partnered with HEB in Texas and Winn-Dixie in Florida and other such retail companies where we are able to give our families a $25 produce voucher every other week. So every other week they get a voucher for $25 that they can go to the HEB or Winn-Dixie, wherever, you know, they are, to redeem just produce. So, you know, to your point, Serena, about the healthy part of it, you know, it's an incentive for them then to go that, okay, the $25 can be spent on the fruits and vegetables that they can buy and enjoy. And it's interesting, we've looked at the data, you know, they're buying mangoes and, you know, delicious fruits and vegetables for their families to enjoy at this time, right? Which potentially they may not have splurged on, because these are splurges for our families right now who are on a tight budget. So anyway, I just wanted to add that.
Yeah.
I'd
Gina,
love to hear from Gina. Yeah.
You're muted.
I'm back. There are so many ways that people can access produce in the Philadelphia area. I think the important thing is to make sure people are aware of where they can start. You know, I think the internet can be quite confusing and take you in so many different places. So just like Shrima said, that there is, we also have the food box program here in Philadelphia for both seniors and low-income families, where they can take their vouchers to a farmer's market So the Food Trust offers farmers markets throughout the city of Philadelphia, where people can take their food access cards and spend that money at the farmers market, and they also get reduced cost produce. We have an organization here that's a for-profit agency, Produce Junction, which sells very low-cost produce in large quantities. Sometimes it's overwhelming. So you really have to know how to cook it. And they do accept food access cards there as well. So again, it's how do we get people to where those resources are? Thank you for putting up that slide. So the city of Philadelphia provided a really wonderful summary of access to food resources throughout the Philadelphia region. In addition to, as we were talking about, the wraparound services with Community Resources Connects, that is to help people access some of the other priorities in their life where they're struggling financially, whether it's utilities, we spoke about diapers and things like that. Phil Abundance is in the Hunger Coalition, the Share Food Program, the Food Trust. They're all at the forefront of addressing food access, food insecurity in Philadelphia. I know Philadelphia, I'm just outside of the suburbs in an urban area of our suburb, and Phil Abundance is out here helping folks through the churches and through distribution centers out here even. So please access these resources. If you're listening from Philadelphia, they're available. You can reach out to Health Promotion Council. We can help connect you. All of the city health centers, there's federally qualified health centers throughout the city of Philadelphia, not just public health management corporations, health network, that can help people access food resources. There's behavioral health components. People are struggling with stress and just needing to connect. As we've highlighted, people are very isolated right now, even with some of the quarantine lifting and the restrictions lifting. People are still in a state of trying to get back to some type of normal, which I don't know if we'll ever get back to.
Right. I think it's important also to hear about considering for the older population. I know I see a lot of my patients, of course, in the hospital. I often see people that are a little bit older, and of course, they're already on a budget. That they don't have a lot of room to try to get healthy food choices, and so they're always looking to see for some other resources. So I think it's really good to hear that was taken into consideration as well. And I think what I'd like to do is going forward, I think for myself, and I encourage my colleagues across the nation who are also working in an inpatient arena, this is still some information that we can provide to our patients as they are getting transitioned to go to their next level of care or go home. We do provide that at my hospital, but we hadn't put information in for organizations such as both of yours. So I think that's something that I'm going to do, having learned more from you today. So thanks.
I would love to add to that, Marianne. In the city of Philadelphia, there's been a collaborative happening across health systems, and they've begun screening individuals at many different levels with just 2 food insecurity questions. So they're making it a part of their care provision and assessment. So there's so much shame with not being able to provide, especially with families. We need to make sure that people feel comfortable coming forward. That should be the first thing that they tell their provider, whether it's behavioral health or physical health provider, that they're struggling with food in any way, or if they're struggling with depression, whatever it is, to come forward and ask for that help and not to feel ashamed.
Yeah, I'd like to ask Serena, I'm sorry. I'd like to ask Serena really quickly, though. I mean, I hear exactly what you're saying, Gina. As I talk to patients, it will come out in the conversation, but not in the beginning. And I do get the notion that there is some type of maybe shame around giving that information and sharing it. I don't know, Serena, do you hear that with the CORE initiative?
Yeah. particularly in peer support, it's already shame of having diabetes. And so then on top of that, oh, I can't really take care of myself even if I try because I don't have the money for this, I don't have the money for that. So a lot of pride, it could be pride or just feeling helpless that people don't ask. But I try to encourage all of my participants, they'll come out and tell me because, I try to draw everything out of everybody, but they'll come out and tell me, but I tell them, well, this is something that you need to express to your primary care physician. Maybe they know some organizations that can help you. I try to help them with the ones that I have on list or that I know of. But I try to encourage them that if something is wrong, it doesn't matter what it is. If you feel sad today, if anybody knows on the peer support page, I'll just put up, how are you? Because people may even have the stuff they need, but they're just not well because of everything that's going on. So I just try to express to everyone to open up their mouths and say if something's wrong, because that's important.
Yeah. So one of our viewers is reminding us, and I'm really happy that we touched on this topic, but that, some people do not have internet connectivity, right? And so to Mary Ann's point, she says that a lack of internet connectivity in senior and low-income households creates an additional barrier. And so it's really important that those of us who, when we have access, when people come to us, that we have the resources ready to go. We have the ability to give them the information when they're either, in front of us in clinic, or we get them on the telephone in clinic. I know sometimes my patients may not have the internet, but they can give me a quick telephone call to let me know how they're doing. And I know that for our nurses, this has been something that we've asked a lot of the times, all the times, but I think it's something that we have to remember that we should do more of now, is to ask those questions regarding, do you have access to self-care resources? Do you have, do you have access to healthy food? Are you concerned with anything? Because I know when my patients come through and they tell me my blood glucose values have changed, and before, they were relatively well controlled, maybe a couple of outliers here and there, but now all of their values, or they're having difficulty, or they're telling me they're rationing their medications. There's probably other things that, as you alluded to, Dr. Sharma, have been, allocated as more important. And so I think that, to that note, we should take the opportunity to provide guidance. Maybe if they don't need it today, maybe they'll use these resources later.
Yeah, to speak to that, Joy, rather than telling them about a place, giving them, if you're seeing them in person, giving them that application, or giving them, actually printing it out for them so that they actually have that hard copy so that they can maybe mail it in, or giving them that phone number rather than telling them about a website so that they can actually make that phone call. I know when I worked in Dallas, we worked with the Diabetes Health and Wellness Institute, which, if anybody knows about that, it's in South Dallas in a big food desert area. And we had opened a clinic, and, of course, so people were getting their medication. Somebody came in, and of course their values went out of alignment. And when we really drilled down and got to the bottom of it, what they were actually doing is trading some of their diabetes pills for some food with another person. The other person in the community needed, some diabetes medication and ran out. And so they traded, it was actually some sausage that they traded for the diabetes pills. And it's very, very heartbreaking, to hear that, here in the United States, we still have that going on. So again, it's so great that we have, both of the organizations that Dr. Sharma and Gina are speaking about today.
Yeah. So do you all ever, in your programming, do you help to fill out, or do you have navigators that can help someone fill out the form? Because I know sometimes, when a patient of mine has a fairly expensive medication, or even not an expensive medication, I will ask them, are you having any issues with picking it up? Is it costly? Has it changed to where you can't access it because of cost? And even if it hasn't, here's a fantastic program. Let's go ahead and do it now. Do you mind if I help you set it up right now? And it takes a little bit longer, but I don't know if she'll have internet access at home or via her phone or wherever. And so I'll take care of it right now, right here. Sign her up for the program and then go from there. Do you all have navigators sort of like that? And I know my social workers are able to do that as well if need be. So our social worker and our community health worker.
We do in the Philadelphia region. I was just going to say we do in the Philadelphia region at any of the health centers, any of the federally qualified health centers. They would be able to connect someone, and especially if someone says, I need help doing it, to walk them through that.
Yeah, and Brighter school-based program, and so we have coordinators at every school, and Brighter Bites programming staff at every school that supports all of from start to the end. And it's really about I know all of us are tied into looking everything in a 20-minute time block from patient to patient, and I think a little bit of that extra support for the families goes a long way. In Houston, I'm also part of this coalition called the Greater Houston Coalition on Social Determinants of Health. And something that we're looking to facilitate is actually building a community information exchange. And that information exchange is exactly what Marianne was talking about, which is how do you link someone to all the services that they need. Thank you, Alicia, for that comment. Alicia is part of the coalition as well, because it takes the burden. How can we invert the burden off of the patient, right? A patient who's already struggling with diabetes, food insecurity, rent, housing insecurity, transportation issues. Okay, now let's layer on 5 places that they need to go to and navigate themselves. We need an infrastructure like a community information exchange where you can make warm referrals wherever you are, right? Whether it's client, I'm self-navigating myself, or coming to you, Joy, and you are helping me navigate, that there is a way for you to refer this individual, this patient, to the service and know that the service has been provided, doing that warm referral and closing of the loop. Because without that, it's really, again, the burden, you're adding layers of additional burden on the patient that's already, drowning in the existing one. So that's something that we're really hoping and looking to facilitate. The analogy I like to use is, we all know that as a provider, you can make a prescription to a pharmacy. That technology exists where the provider can electronically, before you leave your doctor's office, that Walgreens has filled the prescription for you, and you don't have to go to 10 Walgreens to fill 10 prescriptions. The same Walgreens can fill 5 prescriptions for you, right? The burden has been taken off of you as a patient to find out, 10 years ago, you had a paper script that you were taking to the pharmacy and making 2 trips to the pharmacy to get your prescription. That has gone. in the last decade. And it's all been facilitated because of a technology. And we can leverage on these existing technologies. They exist, to invert the burden that exists in the social services realm. So that's something that we're looking to facilitate. And a lot of this work, Philadelphia, San Diego, San Antonio, Dallas, it's happening around the country. And I see it definitely as the next wave, and making sure we're closing the loop around these social needs as well.
Yeah.
Dr. Sharma, you bring up an interesting point also, because looking at it from the patient's perspective, we see how beneficial that is. But I think health systems and clinicians need to also see the value in it for them and for their perspective, because we do know that if patients are sent home, for example, from the hospital or from a doctor's appointment at a clinic, and all they're given is, as you said, another burden, another piece that they have to be responsible for, and they can't keep up with it because they're already overwhelmed, well, then they're back into the health system again, they're back at the physician's office again, and we really haven't moved forward at all. If anything, we've taken, all of us, the patient and the health provider, you've taken a step backward. And so you bring up such an interesting point and a valuable point. So, I hear the value in it.
Yeah. 10 years ago, there was a similar challenge about these technologies and sending prescriptions directly to pharmacies. And now we cannot imagine a world without it, right? Can you imagine giving a paper script to a prescription, to a patient anymore? No. So, but the adoption, the key in these kind of scenarios is making sure that there is adoption of the technology as much as the technology itself. But I can tell you that I see a world where the providers are screening, to Gina's point, everywhere. They're screening their patients for these social needs. And right then, they can make a referral, same way to Walgreens. They can make a referral to the social service within their patient's area, and the patient is taken care of, and that referral has been picked up so that the patient shows up, they know, they're expected. I can see a world where this is going to be a standard of care, because we cannot sustain the burden of chronic diseases such as diabetes. The rate of growth of diabetes and other comorbidities we're seeing we cannot sustain it with the current, so we have to change status quo. And what better way to do it than leverage, the technology movement that we're seeing right now.
Right. So COVID is actually, although kicking and screaming, has thrown us into using this technology even more and finding even more creative ways to use it. But I'd just like to also put a quick plug in for what we are, both Joy and I, we're certified diabetes care and education specialists. And just to put a little plug in for that type of profession, because we are people that are able to work with other clinicians in an interprofessional manner in order to actually see that 360 view with patients, and to help, just as Joy said, she helps her patients already by helping them to fill out the forms and things like that. So, I just like to put a plug in that, clinicians, other clinicians should think about, always referring patients to someone like us in our profession, and certainly also to Serena and her group with the peer support, because they actually live with this and can actually understand it directly from, that level as well. So community health workers, peer supporters, but we need everybody. It's a total interprofessional approach.
Yeah. So to go from there, so we've called to action, all of us clinicians. Hazine and Alicia watching on Facebook are having a fantastic conversation that I really want to highlight here. So they're talking about, now that we've kind of assigned the work and the call and making it clinical practice to ask questions and to expand upon patient needs. They're asking, in what ways can those individuals who are not clinicians, but they do work in nonprofit policy spaces, how can they help to normalize conversation about lack of resources in communities so that you reduce the burden of shame that comes around, not having the ability to provide food and other resource insecurities?
I think coming from the nonprofit standpoint, you have to make it a part of the conversation. The more you make it a part of the conversation, the more people will feel more comfortable talking about it. If we don't mention those issues, no rent, no food, no water, no gas, no electricity. If we don't mention those issues, people are going to think, well, maybe I shouldn't mention it because nobody else is having these issues. If you don't open up that conversation and talk about it more, even when you talk about your programs, talk about the fact that people are dealing with these issues with not being able to get what they need all the time, especially during now when a lot of people are out of jobs. It needs to be a part of the conversation more often than it is.
Yeah, I think you and she are on the same page here. She says, for instance, during the pandemic, she's seen more commercials around mental health resources, but not necessarily for social needs like food insecurity or energy resource, things like that. I think that just like anything else, when we talk about it and we realize that it's a problem that's prevalent, it's a problem that impacts a lot of people, likely people that that you may not even realize this may be an issue for them. I think that once we talk about it, we remove that sort of burden of shame and guilt, right?
Well, and that is such a great comment that was just made. At one of our Brighter Bites distributions recently, the distribution started at 11, but people were waiting in their car from 7 a.m. And we were there from about 7:30 getting ready to bag the produce. The lines were, 2 miles long. The burden cannot just be on the families that are experiencing it to share their story. It's not their burden; it's our burden as a society. If we can, then we must. It's not a problem of the few. If a few people are experiencing it, everybody's experiencing it, and I like to move away from the statistics, even though I'm an epidemiologist and I love numbers. It's really the story, we say, 1 out of 10, that's not too many. But if it's your child, that one is important. If my child, if that one child for me, my own child is important, why wouldn't someone else's child be as important as my own, right? And so every individual counts. And how we have to normalize the conversation by all of us talking about it. The part that always concerns me about these social justice issue, food is a basic need. It's not, we all deserve and need to eat to live. And a child going hungry anywhere is a problem. And or an adult going hungry anywhere, somebody in need anywhere. So it becomes incumbent on each and every one of us to make sure that this becomes part of our conversation, however uncomfortable it might be for us, because it isn't about us. It is about giving a voice to the communities that need it the most. So I think these are such important questions about, again, inverting the burden on these communities that are already, feeling the pain. And now they have to now speak up and talk about it. No, how about we all pitch in and do that work?
So my question, I guess, to the viewers from the nonprofit side, because I don't work on the nonprofit side, what recommendations do you have for us to tell other viewers that may be out here from the nonprofit sector? How do you all make this a concern for you? Like, how do we as a community rise up and make it a concern that becomes one for those individuals who have the opportunity and the ability to say, influence, what public health messaging comes across on television stations and things like that? Does it take one, constituent to tell a representative that this is important? Does it take the representative to go out seeking? Do we file a petition to, Harris County and Philadelphia County representatives saying, this is something that's a major issue here. We want to see it as a the more you know segment or commercials? How do we get that movement going? And that's
Gina,
for y'all viewers. I'm waiting for your comments.
Well, it's for the viewers. Did you say that?
Or let's.
Okay. Well, I'm always on my, this is something I feel very passionately about because I actually grew up in a food insecure environment. And so, it's carried me into where I am today. And I think, I think there's two parts to it. There's one, yes, I think we all have to get on our soapbox, use our voices and push the conversation in anywhere, wherever we are. I think it has to be part of our ethos. But the second part, in my opinion, is that we, even in our professional world, we can't assume that all our peers and professionals that we interact with understand this issue. And so we have to bring it into all parts of the conversation. I'll tell you, Joy, we recently did work training with some dietitians, and there were several dietitians who felt that food insecurity is not something they can deal with. So why go there? And because I know as a dietitian, that wasn't part of our training or conversation. And so if you don't know how to deal with it, the instinct is not to go there. We also do a lot of training with medical school students, and we have many medical school students who don't know what a cauliflower is. Well, if you're not, we know this, that if you don't have a basic understanding of a certain part of science, you're not even going to ask that question. Why? Because it's not been part of your training. And so we have to make sure that the training in all professions includes these conversations around social determinants, which includes food insecurity. And then we can then at least start asking the right questions. Right now, I don't think even the questions are being asked systematically, And so once you ask the questions, you know what the problem is, and then you can do something meaningful about it. So I think there's various ways in which this conversation can be pushed at multiple levels.
Joy, I think you hit it on the nail in terms of talking to representatives, local representatives, our congressional representation, and making sure that they know whether we tweet them, email them, make that phone call, they have to listen to us and address the issues. So if we can empower the people that we're serving, or colleagues, friends, families, to again speak up and make sure it's being heard by the people who can change policy. Keep the conversation happening within our professional world, and making sure that food is always at the basis of all the work that we're doing, when we're promoting health and social justice. And then also, reaching out to the media outlets and letting them know that this is a priority and this is an issue. I know during COVID, there have been the banners going across our news stations with how to access food, but whether or not there's been many stories on it, I haven't seen, specific highlighted episodes around food insecurity and how people can get around that issue.
Yeah, now that you mentioned that, I did wonder, because not a lot of us have been going out, and I'm the assigned person in our family to go pick up the groceries and things like that. And so it just happened that I was driving and I came upon all of this traffic, and I thought, well, where's all this traffic coming from? And granted, I don't watch a lot of television, but I feel like, shouldn't I have heard that this many Houstonians are impacted? And then last night, as I'm watching, there was a feel good ending to the news on KHOU, and they were talking about how a family felt so impassioned and felt a call, from a moral standpoint, from their church, from their faith. They set up in their yard a shelf, like a big thing, and they put food in it. And the sign outside of it says, "Take what you need, give what you can." And it was so powerful. And they're like, they never see who comes, they never see who fills it up, but it gets refilled and used. And so there was this feel good segment about it, but it didn't say from where this passion and this need arises, or the very, very important, I understood it because I'd seen the lines at NRG and I have the patients to tell me that this is happening. But like you said, Gina, I'm not sure that it's getting very much news. I don't think people know that this is happening to their neighbors, or that their neighbors are trying to help one another, in their own way, on their own time.
I have a question for Dr. Sharma and for Gina. Have you seen people using these resources that are also employed or underemployed? Because I know I've run into that. We have a little program at our hospital, and one of the questions we ask people is not only are they employed, but are they underemployed? And I think that there's a lot of people that we think they're employed, so we think they don't have these needs. That's number one. And then number two, maybe one way is to actually, I see on our local news here in Houston that they do ask us to send information and comments to the news station. Maybe one thing at a grassroots we could do is just directly ourselves reach out to our local news stations. I don't know, but I throw that out there.
That's what I'm feeling right now, Marianne. You ready?
I'm ready to write that letter with you.
That could be our call to action.
Yeah.
Okay. Yeah, I love it. I love it.
And Joy,
completely.
you brought up a good point about generosity, people just doing something out of the goodness of their heart. And if there is anyone that is watching, all of the resources that I provided, those are all locations where people can donate, either financially, volunteer. I didn't put Manna on there. We have an incredible organization here that feeds many, many people with health issues. And they are the premier food is medicine advocate in our city. So, people can volunteer to help package meals there, prepare meals, or like I said, donate monetarily if you are so able.
Yeah, that's so incredible. I love it that we can, that we've taken this time to outline what is happening, what our abilities are to impact that, and then leave with this call to action. If you're able to give, what do you call it? The security box at this couple's house says, give what you can, and take what you need. And it makes me feel pretty emotional because I don't love, I hate the thought that anyone would be unable to take care of them and to feed themselves and their family. It shouldn't be happening. And we can make it not happen for a lot of people. I think if we raise our voices together loud enough. So, and we've gone over a little bit, but I think it was really important what we talked about and what our viewers brought up. And again, viewers, if you are looking at this after the show, or if you're still looking now and you think of some thoughts or comments, tips to guide others, or even questions for any of us here in the guest panels, we will get back to you afterwards if you're looking for a way to give of a monetary way or volunteerism during this difficult time for everyone. Please just let us know. And we thank you again, Dr. Sharma and Gina. Thank you for giving on this Saturday morning your time to come and talk about this very, very, very important topic.
Thank you. Thank you for having us.
Thank you for asking.
Excellent.
My pleasure.
All right, so this has been another brilliant and thought-provoking conversation with this talented panel of guest speakers. I'm honored to work with you all, and I look forward to working much more closely with Brighter Bites and our team in Philadelphia. Thank you so much to my Cities Changing Diabetes volunteer partners in crime, Serena and Mary Ann, and also to our viewers. We have a special viewer today who we want to say happy birthday to. She has been here from the get-go, cheering us on. So happy birthday to Kamla Verma. Thank you for taking your time every Saturday to come on the show and give us your thoughts and cheer us on. We appreciate you so very much. So our next episode will air next Saturday, July 18th. We'll take on diabetes management during COVID-19. We will have Dr. Rao, an endocrinologist from Temple University Katz School of Medicine, here to speak with us. Then on July 25th, we'll have Susan Cosgrove with the Healthcare Improvement Foundation in Philadelphia. She will lead us in an exploration of health literacy as we spoke about today. Health literacy is something that's very important and helps us to develop our self-care and management skills, especially for people with diabetes. We also would like to let you know that every Saturday, 10 a.m. Central Time and 11 a.m. Eastern Time, you can link on our MyDiabetesHQ Facebook or MyDiabetesHQ YouTube site in order to see and be part of the conversation. Okay. And just as a quick reminder, anything that we've shared here today should not take precedent over what your physician shares with you or to diagnose or treat you in any way. Please seek the advice of your physician, especially during this very difficult time.